Management of chronic diarrhea. When someone has diarrheal stool more than three motions in a day, taking the shape of the container for more than 2 weeks, 14 days, you call it the chronic diarrhea. Basically, it is the continuation of acute diarrhea turning persistent when some other extra-intestinal infections like throat, chest, and other sites are not being taken care. It goes on unabated. We once upon a time we called it the parental diarrhea. So apart from that, what are the treatment of those cases are ORS, zinc, and taking care of the comorbidities extra-intestinal like your ARI, pneumonia, asthma, throat infection, and others. So at times, now the diarrhea is little bit of your blood in stool, intermittent sort of nature, and prolonged, little intermittent sort of prolonged basically. So you have little bit of growth failure, anemia, and then you have little bit of different disease in your mind. It is inflammatory bowel disease or that is Crohn's and ulcerative colitis. In those cases, you have the one screening test. It's your calprotectin in the stool in the urine. If it is positive, you send him to an appropriate person, the pediatric gastroenterologist or an adult gastroenterologist. So malabsorption syndrome, protein losing enteropathy, they can also have this sort of presentation. Their diagnosis is basically your fecal fat stimulation or fecal elastase measurements, and finally the intestinal biopsy, subtotal venous atrophy. And the other diseases, where you can have these sort of things, the your chronic secretory non-specific diarrhea, obese child in the your when the your they do not have that amount of high amount of purging, do not have dehydration, child is growing optimally but have a little bit of loose stool, so they are chronic non-specific secretory sort of diarrhea. They do not need too much intervention, and they need counseling about the obesity and other comorbidities. In the intestinal involvement, barium enema, barium meal and follow thorough, and the your celiac disease is an important differential over here. Cystic disease, cystic fibrosis is also an important differential. The celiac screens are the antibodies to tissue transglutaminase, endomycin antibody, and gliadin antigen antibody. They are diagnostic of celiac disease, and finally the biopsy. So cystic fibrosis, the sweat chloride test for sodium or chloride in the and then your maybe genetic testing. So these are the rare chronic intestinal diseases that might need referral to a specialized center, and then they are not that common. But when this sort of presentation comes, apart from the typical diarrhea, you have scope. You should refer to a specific better center.